All right. And for and for everyone present, I hope for those who just joined us, I hope you can see our screen. Let's start with your video on. If I have in internet, if your internet signal permits it, let's turn our videos on. Keep track of your mood status. So since this video thing we're turning on your cameras also, you can see it here. To keep track of your mood status. So when you log in, please keep your mic on mute so that our speakers or the mic here won't be interrupted. Use our chat box. So right now, we are trying this online presentation to create of many requests for different release because of the application we have to use. So we also have the need the fact that on the one in English. So we have this or online oriented. All right, we have CPH, the now training and some or we have negative. Thank you so much for joining us. So again, keep your mics on mute so that you will not be getting feedback. No, your mics on mute. All right, so let us start. And our first topic, and also remember, there will be a designated open forum page. We will be using our chat box for questions. So, the speaker is going through the presentation, and if you already have different questions in mind, kindly use the chat box. We will get back to them, and our speakers will be answering them during the open forum. Would that be okay, docs, moms, and sisters? And you use your coming up reaction to our questions during the open forum. Let's not take the latest any longer. We'll start with this circular benefits package for extra cataract extraction with insertion of intraocular lens. Okay, allow me to introduce our speaker this morning, the parent and the benefits of this patient. Round of applause, everyone. So good morning, everyone. I'll be presenting to you the benefits package for extracapsular extraction with insertion of intraocular lens. So the rationale for this is the limited financial coverage an uncontrolled output of expenditures under the Factory Activation C, which is the universal healthcare. Priority conditions in the ACM to improve financial coverage for public healthcare delivery and the Philhealth Board Resolution 2973 series of 2024, which means the adjusted rates for the reimbursement that surgery is part of the ACR rationalization. Objectives. This Philhealth circular provides the policy for implementing the enhanced benefit package for extracapsular cataract extraction with insertion of the intraocular lens to ensure financial risk protection and quality healthcare delivery by accredited health facilities. This covers essential health services for extracapsular cataract extraction with insertion of IOL and shall apply to all accredited ambulatory surgical clinics, levels 1 to 3, accredited public and private facilities with service capability for cataract surgery, including the Philhealth regional offices and all others involved in implementing the case rates for cataract surgery. Can everybody hear me well? Um, statements. Philhealth identified cataract surgery as one of the priority conditions in rationalizing the ACR to improve financial coverage and ensure financial risk protection while transitioning its provider payment mechanism to the DRG, the diagnosis related groups. Philhealth utilizes a case-based provider payment mechanism to reimburse health facilities for the covered minimum standards in delivering services for cataract surgery. Most efficiency, cost containment, and quality of care by providing a fixed payment for a specific case of care, where the health facilities deliver services in a more coordinated and streamlined manner to manage resources efficiently and focus on achieving positive patient outcomes rather than simply providing more services. Overall, Philhealth's skills-based provider payment system aims to align financial incentives with efficient, effective delivery of services. Philhealth shall engage key stakeholders to promote a deeper understanding of the ACR as a case-based provider payment system, which has critical implications for claims processing, medical evaluations, and copies. The minimum standards of care recommendations from clinical practice guidelines designated by the World Health Organization, the Department of Health, the local medical societies, and other guideline sources, which are critically appraised and validated by current best practices in the local setting of health business for service coverage process. And also enough coverage to include new technologies such as drugs, medicines, and biological statistics in the PNF or the Philippine National Frontier because of scissors, surgical interventions, and new treatment interventions shall consider the methodology assessment policy recommendation. It encourages continuous quality improvement initiatives to promote improving cataract surgery in the Philippines, such as developing a patient history and referral network according to global best practices and collaboration efforts to standardize local practice and improve access to quality services delivered by accredited health facilities. The rates adjustment for cataract surgery and the increase in health coverage, all female beneficiaries shall be entitled to no co-payment when admitted to basic or ward accommodation following the DOH Administrative Order Number 2021-005. The standards in basic and non-basic conditioning of hospitals to public and private health. Beyond the field coverage for the minimum standards of care in non-basic accommodation at private health facilities, such as amenities, choice of physician, upgrade of services, or additional services unrelated to the episode of cataract surgery management shall be subject to out-of-pocket co-payment. The co-payment shall be thoroughly discussed with the patient by the attending physician or the physicians who should properly inform patients of the essential services for the management of cataract surgery as part of informed consent. That public health facilities shall not balance bill or charge patients admitted in non-basic condition cases the published reimbursement rate. The package rate for the cataract surgery reflects the average cost taking an episode of care. The actual cost of care patient is different from the actual hospitalization charges reflected in the statement of account, which can be higher or lower than the published case rate. Accredited health facilities should maintain minimum stock levels of intraocular lenses, essential eye medications and life-saving drugs, IV fluids and supplies at all times, to ensure the timely delivery of quality healthcare services and discourage unwarranted out-of-pocket purchases. As stipulated in the Universal Healthcare Act, Chapter 4, Section 18, there will be no differentiation between the facility and professional fees. Philhealth shall credit all payments to the accounts of accredited private and public health facilities. In the case of government health facilities, it is the sole responsibility of the health facilities to distribute professional fees to the attending physicians, health workers, based on the internal agreement. Accredited health facilities may cross-subsidize treatment goes beyond the case rates, recurrent surgery, using either other fund sources, efficiency gains, or pocket spending. Accredited health facilities should follow the CPGs or the clinical study plans to manage patients and ensure adherence by medical professionals who are appropriately credentialed and privileged to practice in the health facilities and all hospital staff in charge of patients with background. Accredited health facilities that lack the service capability for performing cataract surgery shall properly coordinate and facilitate the timely referral of patients to a higher level of facilities that can perform cataract surgery, ensuring patient safety. Accredited public and private health facilities shall participate in the shadow billing for diagnosis-related groups. Queen Health Circular Number 006 for the implementation of para transition to diagnosis-related groups, Division 1 or ACC divisions. Female benefits applications for cataract surgery. Every Filipino citizen shall be automatically included in the national health insurance program. Accredited health facilities shall ensure the delivery of the minimum standards of care for managing cataract surgery according to CPG recommendations applicable to local countries. The hospital, the health facilities shall reflect the cost of intraocular lenses. The hospital paying charges. Ophthalmologists are discouraged from curing and selling IOLs directly to their patients. Philhealth shall allow up to a maximum of 200 approved cataract surgery authorization requests per month, that exceeding 10 scheduled cataract surgeries per day. In case of bilateral cataract surgery, there should be a minimum interval of 2 days before operating on the other eye, except for pediatric patients. These are the benefit packages for adult cataract surgery. Which group is CCAOD, the extravascular cataract extraction right eye, rate of which is 20,200. Same for the left eye. And for the extravascular cataract extraction with monofocal IOL right eye, 28,300. Same for the left eye. Extravascular cataract extraction with monofocal toric IOL right eye, it's 43,800. And for the left eye, it's 43,800. Extravascular cataract extraction with multifocal IOL right eye at 66,900 for the left eye, at same with the left eye, 66,900. And for the extravascular cataract extraction with multifocal toric IOL right eye, it's 80,900. Same for the left eye. The FINA benefits packages for pediatric cataract surgery with the corresponding reimbursement rates. So your pediatric cataract surgery right eye, that's 135,000. For the left eyes, it's also say 1,130. Sorry, it's rather 155,000 for the pediatric cataract surgery right eye, and same for the left eye. And then the pediatric cataract surgery for both eyes is 139,050. For the pediatric cataract surgery with IOL right eye, it's 179,000. Same for the left eye. And pediatric cataract surgery with IOL for both eyes, it's 187,100. In case of a bilateral pediatric cataract surgery, the health facilities shall pay the package rate under PCSOU. This package includes the cost of new or additional sets of surgical instruments, drapes, viscoelastic, and other consumables. Philhealth highly encourages coordination and partnership between accredited ambulatory surgical clinics in levels 1 to 3 health facilities for coordinated patient referrals and other operations. This is a list of the procedure codes for cataract surgery. Procedure code, which is 66840, or the removal of lens material aspiration technique 1 or more stations. 66850, the removal of lens material, phaco fragmentation technique, and aspiration, either mechanical or ultrasonic, such as your phaco extrication. 66852, or the removal of lens material, or slant approach with or without vitrectomy. 66920, removal of lens material intracapsular. 66930, removal of lens material intracapsular for dissipated lens. 66940, removal of lens material extracapsular. And 66982, extracapsular cataract removal with insertion of intraocular lens prosthesis, the one-stage procedure. For manual or mechanical techniques such as irrigation, expiration, or phaco emulsification. Complex, requiring devices or techniques not generally used in routine cataract surgery, such as iris expulsion device, suture support for intraocular lens, primary posterior capsular hexis, or performed in patients in the embryogenic developmental stage. 66983, intracapsular cataract extraction with insertion of IOL prosthesis, one-stage procedure. 66984, extracapsular cataract removal with insertion of IOL prosthesis. 66987, extracapsular cataract removal with insertion of IOL prosthesis. Recomposition. For the styling, the accredited health facilities shall strictly follow current health policies. Claims for adult cataract surgery shall require presentation of results of the best corrected visual acuity. Accredited health facilities filing claims for adult plastic surgery shall submit the following documents: the CSF or the claim signature form, the claim form for the CF4 documenting the patient's clinical history, physical and eye examinations, stand pre and post op infection in the CBA or the best corrected visual acuity done at least 2 weeks after surgery, and the stand pre and biometry result and is done operative record with IOL sticker attached. Example for the multifocal, monofocal toric, multifocal toric. Accredited health facilities filing claims for pediatric cataract surgery shall submit the following documents: the CSF or the case signature form, the CF form documenting the patient's clinical history, physical and eye examinations, scanned pre and post op reconstruction, and PCBA done at least 2 weeks after surgery. Scanned pre op biometry results except for infants younger than 1 year age, where an IOL will not be inserted. It is not corrected record with a receiver attached even is included in this month and decision often. Accredited health facilities should follow all relevant laws such as the Expanded Senior Citizens Act of 2010 and Public Act number 10754 and Act expanding the benefits and privileges of persons with disability, including prospective laws providing mandatory discounts, guidelines reviewing revenue, and order charging based on the daily wage. The SWP CSO Philhealth Joint Administrative Order Number 2020-0001 on operational guidelines for the implementation of the medical and financial assistance to indigent and financially incapacitated patients pursuant to Public Level 468, also known as the Malasakit Centers Act 20. The case rate for cataract surgery shall not be claimed as the second case rate. Accredited health facilities shall properly indicate the out-of-pocket and on co-payment of the member related funding sources in PayPal, Pay Form 2, Part 3 on the consumption of benefits and index to meet SOA following PC number 2023-0026 or the electronic data submission of the statement of account for all case rates claims to identified benefits with the shipment. Accredited health facilities shall file all claims to Philhealth within the prescribed filing period of 60 calendar days. Verifying the numbers of beneficiaries is discouraged and not allowed. This or late filing shall apply except when the delay in the filing of claims is due to natural calamities or other fortuitous event. The existing guidelines of Philhealth on the provision of special privileges to those affected by fortuitous events shall apply. Accredited health facilities may file a motion for reconsideration and appeal for claims denied by Philhealth following existing policies. In case the cataract surgery is done abroad, Philhealth shall process and pay claims based on the remaining balance not covered by any insurance or incurred as out-of-pocket expenses, but not exceeding the published case rates provided within the policy. For claims evaluations and payments, Philhealth shall reimburse accredited health facilities for the service capability of cataract surgery and publish case rates based on the minimum standards of care in an outpatient or inpatient setting. Any amount declared in the SOA that is too low or above published case rates shall not be interpreted as over or underpayment. Philhealth reserves the right to subject any and all claims to medical review before and after payment or reimbursement is accredited health facilities following existing guidelines. Existing rules on all case rates on the percentage allocations on health facility and professional fees should apply to claims for these benefits. Philhealth shall apply the return to center policy for claims documented incomplete requirement, discrepancies in the supporting documents attachments, or incompletely filled out claims forms for compliance within the prescribed period. Monitoring. Philhealth shall enforce current policies and guidelines on monitoring performance of accredited health facilities in implementing the benefits package for cataract surgery and establish strict control mechanisms to ensure quality healthcare delivery and prevent adverse provider behaviors in compliance with existing rules. Philhealth also encourages content experts to review and conduct appropriate studies in healthcare providers' teaching practices during the implementation of the benefit blockages while capital surgery, especially documenting adverse provider behaviors resulting in push inpatient, such as unwarranted increase in hospital charges for intraocular lenses or other fees charged by the health facilities. Cleanup beneficiaries are strongly provide feedback report concerns about the condition after surgery policy or their experience with the benefit available to the corporate action center. Via the hotline 0288 in the action center at philhealth.gov.ph. Philhealth shall conduct communication and social marketing activities in collaboration with experts and stakeholders to educate healthcare providers and the public in increasing their awareness of this risk for cataract surgery following the current social marketing and communication plan. Policy review. Cleanup retains the flexibility to adjust labor rates based on the services covered and the efficiency of healthcare providers in delivering quality care. Cleanup shall conduct evaluation of the case rates for cataract surgery in parallel to the development and transition to priority continuously in collaboration and consultation with key stakeholders, experts, and implementers. This Philhealth circular shall be enhanced as necessary based on the results of policy review. Any violation of this Philhealth circular shall be dealt with and penalized in accordance with the pertinent provisions of RA 7875 as amended by RA 241 and 10606 by the National Health Assurance Act of 2013, the Public Act of 11 with Person Active Act, and the respective implementing rules and regulations, including the Philippine rules on administrative claims for covered surgeries covered in the benefits package that are done prior to the Philippine Health Circular shall be processed based on the applicable existing guidelines. The other package procedures that covered in this package will be reimbursed based on the existing guidelines. In the event that any part, provision of the Philippine Circular is declared authorized or invalid in court of law, our competent authority, those provisions not affected by such declaration shall remain valid. All Philippine circular issuances, rules, and regulations and parts thereof that are contrary to the inconsistent with this Philippine circular are hereby repealed, amended, or modified accordingly. This Philippine circular shall take effect 18 days after publication of official gazette. So this was published January 15, effectivity date which is January 30. Alright, so bakaran went over the circular, no? So you have open the floor of the chat box or the IOL. Someone circular 2025-0001. So we will now be opening our open forum. FBA. Good morning from Canada. So complete na your questions so that we can address your queries or AOL this month. Before proceeding to other topics,
Pwede naman sana. Kaya muna mag... Oh, tano.
we start with you
Oh, live na, live na.
so
Di ba yan ang question na uban?
um, so that I will have do you have any clarifications or questions with regards to our IOL package?
Laway naman ko na.
Our facilities was related to the
Wala ka na. Ano itong ko? Ansyado feeling. Ah, bugo mo. Ina.
Oo, bitawan sa nang siya dumili mo.
Ang mga isa.
princess.
Yung dito sa natin ang ansyado.
No,
Ang floating.
our package submitted prior to this orientation. Will it be considered as good
Hoy, niyo nag.
or anyone? Since the effective date of this technology is on July 2025. So any procedures done before January 2025 should appear as a old package.
Kung before
After
that,
the doctor, old package. We have ASHD. Good day. Regarding with the new circular, could we use the same RBS code 66982 Good morning. Morning. ASHC, can you confirm if it's is ACES? This is ACES. You said on your app, okay, sorry. So good morning. With regards to your concern, look after a circular, yes, you should use the same RDS code, which is 6692. But of course, it depends on the procedure that you have to make. So 6692 should still be used if they come through. I think it's number 8, no? The procedure you have to type in or key in the RDS code. However, if in form 2, number 9, first district, you should be using the code either ECCE to B, ECCE to B1, ECCE to S1. So it depends on the procedure that you are doing. So that 6982 is still the RDS code, but when it comes to giving out benefit package code, you have to use the codes shown in table 1, which is I hope you're clear. Say those next to that.
I-replyan ta nila lang answer.
Okay, now from Amazon. Alright, thank you so much, Gabriel. This is yes, now that we present, we have a question now. Do they want to turn on the mic? Alright, the question on the mic, there we go. Question, ECCE with me and ECCE with please form with app. They will not zero. Clarify lang. Yes, it's without the IOL insertion. Without IOL, you can find because
With. Nagabasa. Ay, sorry.
any other questions cataracts is similar. Okay, I think that's all the one. I don't mean, are you typing or you may want to use your
Sara.
your signal box, your signal.
Marcel, let's na po.
Other one.
Pat.
I think
Na.
we the person that comes to the
Oh,
how
pangatan
is
na.
from perspective of how use
Sima,
the
sima.
office from YouTube video.
Kanin to. No, pero kayo. Sabi lang, sila answer. Ibra, pagkati nga. Oo, tubag to. Yun na lang.
Even for my third year, can you guys type on me or share it? It's I mean we just that long. Clarify when you turn on your mic. Just to have mic.
Kunya, di ba instruction ra po itong 669 something. Ah,
Because I find you have a file name fixed in your system or okay. So the office equals clarification. Others are about file type to submit
pwede si Mila
and
sa
office
si
to be clarify that as you clarify so we have from Ma'am Rhea Benita and then Ligara, or item something
pwede ni ba ang
what RBS code should be used right? So Ma'am first two, no, your question is item number 7 is important too. So item number 7 is important too. There's a
bali mo
diagnosis. So of course we type the correct diagnosis. And then after that, there's a CT10 code is. So after that, there's a related procedure. So for whatever procedure you are performing, it should be placed there to get to the correct OPS. So the RDS code can be found is given on page 10. So it actually starts with page 9, the procedure codes. So it can start either 66840, 66850, 66852, and so on and so forth. Again, it depends on the type of procedure that you are performing. So you have to indicate the correct RDS code in field form 2 number 7. However, if you go lower, you see there on number 9, Philhealth benefits. That's the last portion of each one of CF2. So in form 2 number 9, we should be keying in the benefit package code. So that's the, you can see the benefit package code in your server, that's table 1. So that starts muna ni ito mga ECCE UD, ECCE S, ECCE code 1. So again, it depends on the type of procedure that you are performing. So ma'am, I have to clarify that.
Wala siya
Lara, and we heard also from what facility, Ma'am Amy. I hope it was clarified, ma'am. All right, thank you. Next, we will proceed to test. Reduction result is 1 day post-op. Then after 1 week follow-up, can we use the 1 day post-op for
Ano
reduction?
ba?
Sorry. Yeah, after the usually as for circular, it should be done 2 weeks if I'm not mistaken. You know, then to make applications to say this, if 1 day was on this. Okay, thank you, okay. Question, balance knowledge. Can you show some examples now that for numbers again number 9? I believe that's already answered that balance. And here with the question of mounting, let's proceed to ano so. Follow-up question for talk back to Ms. sa pagsisadok. What are the schools to be used?
Answer na daw gali.
Kinang balik ang radyo. Kaya tayo.
Yes.
Kinang balik ang radyo. Kapag.
Is dependent actually in the procedure done by the anthropologist. You would not want to see it. I'm not so. Next, so I heard you discuss some things with our department. What would be the final dispositions of the same? Um, can you please clarify on the final disposition, like final disposition include? Which final disposition are you referring to? Outside that? It's for class. Within our teaching in relation to the previous question. Okay, so in relation, yes, sir. So in relation to the if the claims were filed before January 15, so if the claims were filed before January 15 and then you are using the full for because this circular took effect January 30. So I'm not what about and then on your mic block different mics to be on board on the device listed. All right, we will get back to the board. Let's proceed. Selectman, good morning. Please tell us compared to the points that we will avoid the night things in the circular from Selectman. No. Pursuing my again, how to avoid the idle things. So maybe the tips that I can give you in relation to this new circular is that again in game form 2 number 7 for the RBS code or the procedure code, you have to type the code katong what you normally see in the RBS also. If you don't have that copy, I think it can be found in the annex or circulars. So for the RBS code. But in Philhealth form 2 number 9, benefits package code, you should be typing in the benefit package codes that are listed in table 1 of circular 135. You can see it.
Oh.
Flashing to you the benefit package codes.
Kayo. Ah.
Thank you.
Wah, dia hingga.
Gawas Hago ano lang.
Usay no ding.
Not RBS. Nay, sa 7. Mag-show na lang sila format para mas klaro sa istorya. Na mo ni forma if ever RBS sa 7.
Hindi ko lang. Oo na, ma'am. Si Mano. Sabi ka ano, palit na siguro.
Di pa pagagi nga katong baik kay birthday sila.
O man, siguro bayad yun na yun. Nang sa mutalo. Kung PHA ka naman tayo. Registration nga.
Orientation yung kabako. Idaw.
Pa. Dara. Ito ka.
Balik.
Phone number 9.
Nakon sa ano.
And then for team for two number 7, RBS score. It's still our usual RBS score. So ano siya ang mahimo po. So team for two number 9, then you should be using any of these codes.
RVS
So
11.
and then of course, you have to make sure that you attach all the documentary requirements, and they should all be properly filled out. So I think these are the tips that we can give you on how you can get our age increase. I hope that was clear, Suleiman, on the text we're looking for to. Next, let's proceed to question of Nalata. So we already submitted themes from 1 onwards using the package. Our during the school day or the events of the procedure. The date of the procedure falls prior to the activity of the circular, you will be reimbursed with the old rate. However, if it falls on or after the date of the activity of the circular, then the new rate will be active. Thank you so much, Rocky. Let's proceed to question number 4. In addition to the 6692 question document system, we cannot use two codes. So this code will its code will automatically appear in the same frame in number 7 and number 9 is left two. I will also ask the provider if it's possible to use previous or previous services. For now, sure now for professional, I think that's what you need with your provider because if you will key in the 66982 or 66987 in clean form 2 number 9, you are able to be returned to facility because that is not the correct benefit package code anymore. We have shifted no, so I think you have to coordinate with your provider.
Bago na.
I hope that was
Nano
we did not
si ma'am no.
that's in hiring from the
Nanay ba ang kon?
Nakasign na ka.
Sandra Bruno.
Sa
We
buwan
also
lagi.
find from what Sandra Bruno. Sorry, not Sandra Bruno. Please, services lang.
Sa HIMS.
And
Sa HIMS
Na
brand.
na sa project.
provided.
I-update no nila.
So the what we need is expand the services and the coverage. Okay, so I'll be referring to for the database accommodation. But technically our circular even nakabutang siya doon, no for payment for services which is part of the basic. So what is basic for cataract, of course not the procedure, then on the lens insertion. Normally, walang may room accommodation. Cataract patients because is usually performed on patient basis.
Patient.
So, what can you please lang expand on if I'm able? Can you please let me know if I'm able to answer your question? Jobs lang. Do you want to use your microphone of the device you're using? Okay, that we will get back to your clarification also. Let's proceed to a question from Sonia. We would like to clarify points regarding the circular, as I understand it. There is a provision allowing us to use PCCPOB and PCCPOS for claims in cases where the patient purchased the lens externally, rather than from the hospital. In circumstances, the department would still have this sticker. However, the itemized billing should not include any idle charges. Would you please confirm if this understanding is correct? Ma'am Gina, yes, I think we answered you that yesterday, and I think you called the office, and yes, that is correct. Please, verified receipt from Sawa. Let's proceed from Micros Polymetric. I just want to clarify exactly the differentiation between hospital and EF as stated in the policy statement at the end. Thank you.
Letter N.
No differentiation. Right. So this simply means that when we say no differentiation, the complete package amount is paid directly to the facilities. So we do not differentiate anymore how much should be for the facility and how much should be professional fees. So that's the meaning of dual differentiation between hospital and professional fee. So it is the entire package amount that will be paid directly to the hospital. Thank you, Dr. A. I hope that was clarified. Ma'am, from Negros Connecticut Hospital.
Balikan
Short question po, ilang patients are nakakita ng immediately after surgery? It would be hard for them to come back to 2 weeks after to have the PA or reflection. You know, if it's still Amanda, again, as mentioned earlier, 35 is central office. We understand, no, that's true. You know, patients, you have a lot of patients out of town, so we understand your concern. So, but again, not to refer this first to central office before we give you a final answer, because we might be giving you the wrong answer. So we'll just get back to you after we contacted central office. Thank you. Thank you, Ma'am Rosa. Thank you, Doc. Question from Paulinatic. Does it mean that it is a facility's discretion to determine the sharing between the hospital and doctor, or still we follow that's reported as stated in the ACC? I think in the latter part of the student's so it demonstrates that we should follow the application for HCR or health facilities in PF based on circular 35 2013. So that's the 7030 for procedure and 6040 for medical, so sorry, 7030 for medical cases and 6040 for procedure cases. I hope that was clear. Sir, sounds not. Back to the question of the photo, I think this was your clarification. Regarding filing to submit the claims, should we tag lang others a result for pre or post-occurrence surgery evaluation for in my materials for you to buy the files. So I'm just now clarified with one of our educators on from all other humans be attached, can use the file type others. Uh, uh, a microphone as well. Yeah, and from the passport. I guess, no question from Medical Mission Hospital Law. Ma'am Sheila, do you have a clarification? Okay. Okay, ma'am, we'll wait for question. Good morning, good luck. Clarify the yes, code 669 will summer and the corresponding credit for the due to the SOA or the new capital for ACC Google. Hold on, Matt. Clarify this with the jury.
We clarify for them. Yan yung mga joke eh. Sure kung may tuwan mas lang.
Or with our adjudicator, so you should include all. So it means you include the 66982 and the ECCE mode in your SOA.
Include the
Include all the ma'am, Madam Manares. I think we have finished all the questions in our chat box. No more questions in the chat box, so we'll be proceeding with the next circular.
RPS o
Thank you so much. For additional questions, kindly with one one question for IOL so that we can proceed to other circulars in the long term. For BCA format, it states that at least 2 weeks after surgery, what the procedure will be performed after 8 weeks for later job. Alright, so Mr. Mumpar, we will clarify that with central office and then we'll get back to you as soon as our response from them. Thank you. Our next circular. Alright, I'm clear month. Thank you so much. Let's proceed to our next package. Circular for 3 years of 2025.
Nakalin.
Benefit package for ophthalmic services to children 0 to 15 years old. Allow me to call on here at Tamparo from the accreditation and quality assurance. I see that you have question on the web and cited there and get back.